Hi, my name is Jon Giles. I'm a rheumatologist and a clinical researcher, primarily focused on rheumatoid arthritis from Columbia University in New York City. And I'm speaking to you today from the first day of ACR convergence meeting on November the 6th. And focus today is on TNF inhibitors for this talk. We actually didn't have all that much specifically on TNF inhibitors today because there were no RA treatment poster sessions or oral sessions today, but there was some indirect talk about TNF inhibitors. I think the most pertinent to everyone's clinical practice right now was one of the plenary abstracts, and that was plenary number 457, which was the investigation of COVID vaccine responses in people taking various forms of immunosuppressants, one of which was TNF inhibitors. The overall message from that abstract was that in general, compared with the other types of immunomodulating medications, that people taking TNF inhibitors generally had fairly good responses to COVID vaccine. Their overall response was only a few fold lower than people not taking any of these medications. And compared with, say, B-cell therapies or Janus kinase inhibitors, was actually quite good. But if you looked deeper into the abstract and some of the graphs that were presented, you could actually see that the response across the TNF inhibitor group was actually quite wide. So there were quite a few anti-TNF treated patients who had very low responses in that group. And some who had pretty normal responses. So I think that the lesson here for us is that it's not impossible for our patients on anti-TNF therapy to not mount an adequate response to COVID vaccination. And we shouldn't think about this group of patients as being necessarily protected. And of course, the issue that a lot of patients who take TNF inhibitors are also on anti-metabolites like methotrexate, leflunomide. They also may take some prednisone, that there might be some combined effects in these patients. One other issue that was also slightly of a concern in that abstract was concerning that there may be a reduced protection from some of the variant strains of COVID, such as the Delta variant, although the numbers were quite small. And it seemed like TNF inhibitors seemed to have the least protection against the Delta variant in terms of neutralizing antibodies. However, in terms of my experience with our patients and in an area in which the Delta variant for months has been the predominant COVID strain, really haven't seen that played out. And maybe that is just an element of just the small numbers in this particular sample. So I think on the whole, I think we can be very happy with our anti-TNF treated patients and counsel them that their response to COVID vaccine is likely better compared with other types of immunosuppressants. But I don't think we can be complacent that they are as protected as someone in the general population who's not on any of these medications. So that's my takeaway about TNF inhibitors from the first day of ACR Convergence 2021, and hope to be able to talk to you again tomorrow about more abstracts related to TNF inhibitors in the treatment of our patients.